In today's video, we will look at some of the evidence available on the history of cancer. How old is this disease and which civilizations were affected by it? Based on the available evidence, researchers believe that cancer has afflicted humanity since prehistoric times, and its prevalence has increased in recent decades with rapidly aging populations. In the last 50 years or so, sedentary lifestyle in the general population with an increased presence of carcinogens in the environment and consumer products has helped the cancer to increase manifolds. The oldest scientifically documented case of disseminated cancer was a Scythian king who became victim of cancer in his 40s, lived in the steppes of southern Siberia 2,700 years ago. The earliest written record describing human cancer appeared in ancient Egyptian manuscript discovered in the 19th century. This was around 1500 BC. The oldest evidence of cancer in mammals consists of tumors found in fossilized dinosaurs and human bones from prehistoric times. A study was done using CT scan, that is computerized tomography. Out of 10,000 specimens, 0.2% showed metastatic type. That is an advanced form of cancer. It happens when the primary cancer spreads to other parts of the body. The earliest cancerous growths in humans were found in Egyptian and Peruvian mummies dating back to around 1500 BC. According to researchers, there is some evidence available from Greek and Roman era. Cornelius Celsus was a Roman physician and prominent Hippocrates' successor. He described the invasive nature of carcinomas. He wrote, "This also is a spreading disease, and all these signs often extend, and there results from them an ulcer which the Greeks call phagedina, because it spreads rapidly and penetrates down to the bones and so destroys the flesh." He was the first to attempt reconstructive surgery following the removal of cancer. Galen, Hippocrates' most prominent successor, his greatest contribution to understanding cancer was by identifying lumps and growths into three categories ranging from the most benign to most malignant. A lot of work was done on the research and treatment of cancer in the Middle Ages. After Roman, Arabian physicians, scholars and medical writers took over, and the prominent names are Abu Bakr Muhammad ibn Razi, also known as Razas, and Abu Marwan ibn Zahu, known as Ibn Zo. The most important is Ibn Zo, who first described the symptoms of esophageal and stomach cancer in his book called Practical Manual of Treatments and Diets, and proposed feeding enemas, which are an injection of fluid into the lower bowel by way of the rectum to keep alive patients with stomach cancer, a treatment approach unsuccessfully tried by his predecessors. Like Hippocrates, he insisted that the training surgeon should complete hands-on training before being allowed to operate on his own. By the end of the 14th century, Ibn Zo became well known in university circles of Padua, Bologna, and Montpellier, where he was considered one of the greatest physicians of all time. Successive publication of his book and translations ensured his influence through the 17th century, when Paracelsus, a Swiss physician's new treatment paradigm stressing chemicals, ingredients rather than herbs, initiated the decline of Greco-Roman medical tradition. In the meantime, several events marked the Islamic world decline that sped up the decrease in traditional Hippocratic and Galenic medicine. This is the Mongolian capture and sacking of Baghdad, the capital of the Abbasid Caliphate in 1258, and the defeat of the Emirate of Granada in 1492 by Isabel, Queen of Castile and Leon, and her husband Ferdinand II of Aragon, ending the centuries-long Arabian rule of the Iberian Peninsula. With the end of Islamic empire and dominance on medicine, Europeans took over and made some big advancements in the field of science and technology. Gabriel Fallopius is credited to have described the clinical differences between benign and malignant tumors, which are largely used today. He identified malignant tumors by their woody firmness, irregular shape, multilobulation, grip to neighboring tissues like skin, muscles, and bones, and by congested blood vessels often surrounding the lesion. No one proved Galen's theory wrong that cancer is caused by black bile in the body, until French physician Jean Astruc experimental in 1759. He compared the flavors of cooked slices of beef and breast cancer and finding no real difference, concluded breast tissues contained no additional bile or acid. Based on this new lead, Henri François Ledru, one of the breast surgeons of his time, suggested that cancer developed locally but spread through lymphatic system becomes fatal. This observation was accurate to today as well. His successor, Jean-Louis Petit, advocated total mastectomy for breast cancer, including a resection of auxiliary glands, that's lymph nodes, which he correctly judged necessary to prevent it from coming back. How cancer did begin and what were its causes remain puzzles, and several academic institutions promoted the search for an answer. For example, in 1773, the Academy of Lyon, France, offered a prize for the best scientific report on what is cancer. It was won by Bernard Perel's doctoral thesis, the first investigation to explore the causes, nature, patterns of growth, and treatment of cancer that rose Perels as one of the founders of experimental cancer researchers. He suggested the presence of an cancerous matter, a cancer-promoting factor similar to a virus, emerging from degraded or decomposed lymph. To test whether the cancerous matter was contagious, he injected breast cancer extract under the skin of a dog, which he kept at home under observation. The experiment was interrupted when his servants drowned the constantly howling dog. Perel also contributed to the concept of the local origin of cancer and cold distal disease consequent cancer, we now call metastasis. Like Petit, Perel's breast cancer surgery included removal of the auxiliary lymph nodes but added the pectoralis major muscle. In 1882, this operation further improved by William Stewart Halstead, a New York surgeon who promoted radical mastectomies, which consisted of removing the breast, the auxiliary nodes, and the major and minor pectoralis muscles in a procedure. Meanwhile, Giovanni Battista Morgani contributed greatly to understanding cancer pathology through his monumental publication on the seeds and causes of disease as investigated by anatomy, which contains careful descriptions of autopsies carried out on 700 patients who had died from breast, stomach, rectum, and pancreas cancer. Jean Godinot, head of the Reims Cathedral in France, donated a considerable sum of money to the city of Reims to create and maintain a cancer hospital for the poor. The Hospital of Cancers was founded in 1740 with 8 cancer patients, 5 women and 3 men. People at the time believed that cancer is contagious disease, so this hospital was relocated outside the city in 1779. In 1761, John Hill warned about the harms of chemicals, especially fine tobacco snuff. At the time, people were indulged in sniffing finely ground tobacco. Percival Power drew attention towards lead poisoning and chimney sweepers cancer related to chimney soot. Surgeon Franz Koenig, who is known for first using X-ray to visualize a sarcoma in an amputated leg, and Pierre Paul Broca, whose essay on the pathologic anatomy of cancer provided a foundation for cancer staging and hence analytical assessment that continues today. Johannes Andreas Grip was awarded the 1926 Nobel Prize in Physiology or Medicine for his discovery of spiroptera carcinoma. Marie Curie decided to use radioactivity for the treatment of disease and was awarded the Nobel Prize in Chemistry in 1911 for the discovery of radium and polonium. She was the first woman to win a Nobel Prize and the only woman to win the 2 Nobel Prizes. Mustard gas was widely used in World War I and World War II by both sides. After World War II, mustard gas, radium and X-ray combined became the basis of modern cancer treatment. On 27 August 1942, first dose of chemotherapy was administered to a patient suffering from lymphosarcoma. Over time, global population has increased manifolds, and so has cancer. Research is ongoing, and one day, hopefully, we will beat cancer. This concludes the second part of the cancer series. I recommend you watch the rest of the episodes on this series, which cover the chemicals responsible for cancer development and the most common types of cancer globally and the future of cancer. If you found this video informative, you can share it with your family and friends and subscribe to this channel for more informative content. Thanks for watching.